Just saying hello as our first 50 people have joined the room. We're going to get started sharply at 8 o'clock. It's Sharon Avery from the Toronto Foundation. If you want to take our poll, our first poll, just look in the left toolbar, click polls, and we'd love to know who's joined us today. There are 347 of you registered. So good morning and thanks for joining us. We'll get started very soon. I see we're getting some folks from around the world on this call this morning. Hello in Madrid. There are 73 of you in the room so far. If you want to take a second while we wait for others to arrive, you could take your poll. The first poll in the left-hand toolbar, just click polls. And we're just trying to get a sense of how many different folks are with us today. We have about 347 registered, and we're so excited to start in about 3 minutes. Good morning, everyone. It's Sharon Avery from the Toronto Foundation. We have 101 people in the room now. We're going to start in another 2 minutes, but while you're waiting, those that have arrived early could take the poll. Just click on polls in your left-hand toolbar, and we just want to get a sense of who's here, and we will get started promptly at 8 o'clock. Hello, everyone. It's Sharon Avery here from the Toronto Foundation. I'm going to be joined by some wonderful folks who got up early this morning with you And it's so funny, this whole Zoom world, we look at ourselves too much. So I'm just going to look at the camera and I'm going to say thank you for joining us again this week. It is our second Better Toronto Coalition webinar, our attempt as a community foundation to bring together a wide variety of actors in the space. And we're talking about org leaders, we're talking about funders and donors, we're talking about caring citizens. And it's really neat to see in the chat room how many folks are joining us, not just from in Toronto, which is where we're primarily focused, but folks from around the world. And I'm quite certain that this group is going to expand. We had 356 people register for today. I can see there's almost 200 in the room now, and we're going to get started because we have a full agenda. I ask while I'm talking this morning, if you'll take 2 seconds in your toolbar on the left is a poll. We just want to get a sense of who's joined us to make sure that our content is appropriate for everyone. We know we have a wide variety of our friends and family here. Many of our grantees have joined us, and we're really attempting to make sure that the small and medium-sized orgs that are doing the heavy lifting with the most vulnerable populations in Toronto do not get left behind in this COVID-19 crisis. And I know it's been a week since we've been together and so much has happened. But I think that a morning together, an hour together in the morning can really, I think we're all finding it really intimate. You know, you're going to meet folks who are inviting you into their homes and telling you their real stories of their organizations. I'm going to give our speakers their proper dues in a moment. I have Leticia, Lindsay, Susan, and Neil waiting in the wings. I'm particularly grateful to have Lindsay here from the Toronto Aboriginal Support Services Group here in Toronto, having some real challenging times with a wide variety of Indigenous-led organizations doing amazing work. And I think it's only appropriate to start by acknowledging, though, well, at least I am currently sitting on the lands of First Peoples in Toronto. This was a meeting place of many First Peoples over thousands of years, including the Haudenosaunee, the Huron-Wendat, the Anishinaabe, and most recently the Mississaugas of the Credit. And truly, I often say the First Peoples were the first philanthropists on this land, welcoming settlers in first contact and helping us survive those first winters. And I think that sense of community, that sense of reciprocity is something that we talk a lot about at Toronto Foundation, but I don't know that it's ever had more meaning than it has had in the last few weeks. We are really doing this as well to inspire as much generosity as possible at a time when we are dealing with both a health crisis and a financial crisis. And I think that that has made this a very strange emergency. And I think a lot of people are asking themselves what they can be doing. And so, though you're going to hear us talk a lot about the things that are needed financially, we also invite folks in the chat room to be highlighting other ways people can engage, things that are needed, skills or volunteers or gift in kind. We really want as much content as possible in chat that we can capture and share with our fund holders and other funders and caring citizens of Toronto that want to do something at this time and are feeling a little helpless. You know, a lot has changed since we spoke a week ago. The city and the province have both declared states of emergency, and we're just learning the implications of that. I know I was listening to Metro Morning this morning and all the parks closing down in the schools and the city parks, and how much more tied to our homes we will be, and how challenging that can be for some. And we're going to talk even more about that in next week's gathering. But I think a couple of reminders for you. Please, if you have questions throughout our speakers, we have 4 amazing folks here to talk to you today. Please don't hesitate to write your questions in the chat as soon as they come to you. You do not have to wait. We're trying to gather our questions in advance so that we can be as efficient as possible. And a lot of you will have similar questions, so please do use that function. We will be keeping track of them. So I think we will get started with our first guest. Looking at a bit of a higher perspective, we talk a lot about, well, you're hearing a lot in the news about food security and food insecurity in Toronto, and we couldn't think of a better partner to bring on to talk about that than our friend and CEO of the Daily Bread Food Bank, Neil Hetherington. Where's Neil? There he is. Good morning, Neil. Thank you for joining us. I know you're getting up early anyway, Neil, but to give us an hour of your day when you could be doing other things, we really appreciate. Can you just start by giving us what the role of the Daily Bread Food Bank has been? There's sort of this before and after world now, but the before, and then we'll talk about what today looks like for you.
Sure. So the before, every week about 15,000 families turn to Daily Bread agencies across the city to fill the gap between what they can afford and what they need for their family. So it's obviously a vital service for the city. And at the same time that we're filling that emergency food relief, we are cognizant and spending a lot of our effort on advocating for systemic changes that will decrease the number of individuals who have to make use of food banks. So moving on to sort of what
dive right in. Like, what does today look like, Neil? Like, how has this all changed? That sounded very organized and sorted.
Well, when I turned on the camera, I realized how tired and horrible I look, and because it's been a tiring sort of period subsequent to over the last two weeks. We've entered into a number of different phases and have been relied on and called upon in many new areas. And I have been, we have been challenged as an organization to meet those needs, but uplifted because the staff and volunteers have risen to the occasion. Before the pandemic, we were experiencing a 7% growth in the number of people who need to make use of food banks, and so that was obviously problematic and challenging for us to keep up with. And we're just anticipating that to more than that growth rate to accelerate by at least 3 times over the next couple of weeks. So it's been a daunting task ahead. And the number one thing that we've had to deal with has been around staff anxiety. We are not trained essential workers in the healthcare sector, yet we're asking the social workers, those in the social sector, to rise to that occasion. And so that has been a demand put on staff that has really created a great sense of anxiety. And so we've had to work on that because they also have this incredible pressure. If we don't send the trucks out, 15,000 families don't have the meals that they need for the week. So so you have this enormous pressure and a staff anxious about rising to the occasion. We also had about 30% of our network remove themselves. So we, distribute food through, places of worship, as an example, and that have shut down, or community centers that have shut down. And so the distribution channels decreased by about a third right across the city between North York Harvest and the Daily Bread Food Bank. And so that happened. We had drivers who were anxious about coming in, and so we actually had some transportation issues that we needed to rise to. But what has been fantastic has been the number of partnerships that this has created. Where there is a need, there has been individuals and corporations in the city say, I want to be part of a solution. And so AMJ Campbell has started to do all of the pickups, and they're good at logistics and moving, so they have done our pickups of food. We have broadcast out to the city, if you want to be part of contributing food, make use of Amazon. Have food delivered directly to the Daily Bread Food Bank. Don't even go outside, and just, you know, from the comfort of your living room, go on Amazon Prime and have food delivered, and we'll make sure it gets to somebody experiencing poverty. We have partnered with the libraries, so in the next day or two, we'll be announcing different pop-up food bank locations that will fill that 30% drop that we had in distribution. And so librarians will be sorting food rather than books, and distributing that to those who have identified as needing it. So the number of partnerships has been uplifting, and I'm pleased to say that we haven't missed a single delivery in our network right across the city. It's been sort of a hell or high water kind of thing to get to that point, but challenge by challenge, we've been able to accomplish it. The city has been absolutely fantastic. I will throw out kudos to them. When we have had a problem, you know, Toronto Community Housing saying we can't have food banks in our buildings, 20 minutes later, there was somebody on the phone being able to deal with that problem and reverse that. Every fire we've had, the city has done their best to be able to put it out right away, and that's been amazing. My colleague, I'm going to finish, I guess, now, because I think I'm probably at my time, with a tweet that my colleague Talia Bronstein sent out yesterday, and she said, it took a pandemic for people to realize homelessness is a moral outrage and public health a disaster. Childcare fuels the economy. People without health insurance are highly vulnerable. Food insecurity is rampant. Service workers are essentials. Social service workers are essential. Hope we don't forget this when we return to our new normal. And I think she's right. This pandemic, if you can look and try to find glimmers of hope, for me, it's been around accelerated partnerships and the realization for many people how the day-to-day of tens of thousands of Torontonians who are already experiencing poverty, what that looks like and the anxiety that they have, and that we can all be part of a systemic solution.
Thank you, Neil. That's amazing. And thanks for giving us all of that color. I'm going to move now to Leticia. Hello, Leticia.
Hi.
Leticia and I both have 8-year-olds, and we're, you know, so if any little heads pop over shoulders, which has been one of my favorite parts of Zoom this week, is seeing all my colleagues and their sweet children, we'll understand why. So Leticia Deawuo is the director of Black Creek Farm. And thank you so much for joining us today. Talk to us about what, again, like Neil, give us the before Black Creek Farm and then the today Black Creek Farm, Leticia.
Yeah, so just to give a quick background, Black Creek Community Farm, we're situated in the Jane and Finch community. Our main focus is really looking at food insecurity within that community, and also providing outdoor environmental education programs for kids all the way from kindergarten to high school. We also provide a seniors program which focuses on reducing senior isolation and building connections among seniors. So, you know, before all of this, we were actually planning our maple syrup day at the farm, and also planning activities for March break camp at the farm, and also, you know, doing a ton of community preservation workshops and activities as well. So all of that had come to a halt. We had to cancel and shut down everything. And it was within that we actually started the emergency food box program in partnership with Foodshare Toronto. So, you know, in shutting down everything, we recognize that, you know, the most vulnerable within our community, the seniors, families, they're going to struggle food insecurity within our community is large. Many people are doing gig work or temporary temp work. So when we started the emergency food box, we thought maybe we're doing 100, maybe 200 families just to support them in this time of need. And we reach now to 1,700 food box requests. So we are a very small team of just 6 staff that started this. It's been quite overwhelming, and we've been able to chug along and fill the spots with the support of Foodshare Toronto. So deliveries went out yesterday, deliveries are going out today and tomorrow as well, and families will receive a food box there. Yeah.
Who are you seeing? That's astounding. A couple hundred to 1,000. I see a question in chat about your connection to Foodshare. You're partners, aren't you, Leticia? You're not part of
Yeah.
Foodshare.
Yeah, so Black Creek Community Farm, we are a registered non-for-profit, but we're also part of Foodshare's supportive partnership platform. So similar to a trusteeship with Foodshare Toronto, and Foodshare has already been a partner of the Black Creek Community Farm project. The Black Creek Farm is a partnership project between African Food Basket, Foodshare Toronto, York University as well. Yeah, and they've been a huge support, and they've been helping us with this project as well.
I think it's important just to say to those donors and funders on the call that that's what often grassroots organizations look like. They form trusteeships and partnerships. It's a very innovative, nimble model, and it allows them to have their independence, but also to receive donations. So you can donate to Black Creek, and clearly that's what we're hoping to inspire today. Talk to me, Leticia, about any particular stories that stand out for you in the last week or so.
Well, not a particular story. One thing that I wanted to just touch on a little bit around food insecurity is the fact that already we know that 4.4 million people in Canada go without food. And in the Jane and Finch community, the rates of the inequities that exist within our community is much higher. So with this pandemic, it's been exacerbated, right? It's become much bigger, and it's very worrying to sort of see what is going to happen to folks in the next month or two. Like right now, things are bad, but I think things are going to be worse if people's the jobs that they depend on is temporary, or they do not have access to EI, because many people do not have access to EI to be able to access that 55% pay or whatever that may be. So I think it's very worrying what the next few months is going to look like. And I think the packages that the government have announced is pretty great, but it doesn't address, it's not for those that are most vulnerable right now. So in terms of stories, like we have multiple stories of people calling, like for instance, we decided that, we are only able to support families within Toronto and not anyone outside of Toronto. And, we had the unfortunate task of calling people who had registered that are outside Toronto that they can't get their box. And many people were really devastated. And they're like, well, there's no other services for me. This is what I've been dependent on, or I'm under quarantine and I can't really go outside. And this is the box that I'm dependent on to be able to feed my family. So, yeah, I think, it's pretty devastating. And I think as a community, this was just us coming together to try to figure out how we can take care of each other in this difficult time.
And it's one of the things I love about working with organizations like yours. And we're seeing that. I know we're going to hear some stories from Lindsay about how communities are coming together. Vulnerable communities are coming together in powerful ways and just doing the work. Because I also know how much you work with other grassroots organizations, Leticia, if we are obviously saying look at Black Creek as a place to donate, but if you could shout out another organization you see struggling in your area, who would you say also that people should be paying attention to, that we should be paying attention to?
African Food Basket is another organization that I think we should definitely support in this pretty difficult time. Another organization I want to bring up is also the Black Creek Community Health Center. I know they're a health center, but also some of just listening to Cheryl yesterday, some of their requests is around safety equipment and medical supplies, so that her team can also be safe. They are an essential service, and there is, medical supplies is pretty low right now. And they're on the front line supporting families. And these are some of the things that they need to be able to provide health services to people within our community. And I think they really need that support. And I'm also going to mention Foodshare Toronto, because when we started this project, we were the only ones doing it. Other organizations have taken that on, and it's also putting a strain on Foodshare as well to be able to coordinate with different organizations, small grassroots organizations across the city, to be able to provide fresh fruits and vegetables. And the donations that they get is what also allowed them to be able to set up other organizations and to be able to provide food, drivers from delivery drivers on the road to people packing the food in their facility as well. So yeah, I think that would be really good to support them.
And I thank you so much for doing those shout outs, because I think that's the other spirit we're seeing. Last week, I remember one of the quotes from Bruce McDonald from Imagine Canada, that people are leaving their egos and logos on the shelf. And this, the spirit of collaboration and boosting other organizations is beautiful. Thank you, Leticia. I'm going to move now to Susan Bender. Welcome, Susan. There she is.
Hi, good morning.
Hi, Susan. Good morning. Susan is the manager of the Toronto Drop-In Network. And I'm going to, like everyone else, I'm going to get you just to start by explaining what the Toronto Drop-In Network does or did until recently, and then what's changed for you in the last little while.
Great, thank you. Well, we're a membership organization, and we have over 50 drop-in members across all of Toronto, including South Etobicoke and Scarborough. And as an organization, we really try to listen and hear what our members need to be able to do their work as well as possible, to design and provide training, to bring members together so they can share their skills and knowledge. And to be at the tables and participating in advocacy, so that drop-ins can have the resources that they need to do their work, and also to improve the lives of the folks who are coming to drop-ins, whether that means expanded health services, overdose prevention sites, increased income security through wages or OW welfare. So we also participate in the advocacy very much so, because the context people are living in certainly impacts on what services they need in the community. It's really neat. All the drop-ins are very unique, and they're responding to the needs of the folks who are in their neighborhood, who are homeless or street involved, or living on low income. And they really provide this kind of sanctuary space where people can come and be welcomed and respected and supported where they're at, where they can access basic things like laundry or showers, where they can eat a meal in a kind of a community setting. And then we do lots of referrals to help people find housing or health services or other things that make a difference for a person at any given moment. So, over in 1 year time, we could be welcoming over 1 million people into drop-in spaces across the city, serving almost 1,500,000 meals, and multiple referrals. So that was before COVID-19. Right now, the first thing I really would like to do is to really acknowledge and recognize the incredible commitment and passion of people who are working in drop-ins, volunteering in drop-ins, and are struggling to continue the service. They really are in the front line of the emergency response to this pandemic, as healthcare workers are, and they're often working without the same level of protective equipment. So right now, drop-ins, most of our drop-ins have had to close their spaces because we just haven't been able to organize them to keep the social spacing that's recommended. And but drop-ins are really committed to still trying to ensure that community members can have takeaway meals if we can't provide meals that people can sit down. So we're always in desperate need of food items that can be converted into takeaway meals, takeaway containers, survival items like hand sanitizers and single drink water bottles that people can take away. We're trying to ensure that for folks who have phones that there can still be that connection, because the anxiety and fear and social isolation that folks will be experiencing can be really, really very stressful, and actually really impact on people's health. And so we're really trying to be at tables. TDIN is trying to be at tables where we're problem solving around making sure that folks who are street involved and homeless are not harmed by some of our public health messages and public health practices that are in place to protect everybody. So that's kind of a nutshell of what we're experiencing with drop-in services right now.
Susan, I heard Neil talking about staff anxiety. Leticia didn't talk about it, but I'm pretty certain her team is stressed. How are because I imagine you also have a lot of volunteers. How are they handling this? And I'm just going to ask Leticia to mute her microphone. I think maybe she's not on mute. There we go. Continue, Susan.
Yeah, staffing is one of the biggest challenges, and Neil spoke to that as well. We have staff across the drop-in sector and across the community sector who, take care of seniors who have compromised immune systems themselves. And there's a lot of anxiety and questions about whether I should be at work or not. And it was flu season before the pandemic. So we are very, very thin on the ground for staffing. It's really one of the most vulnerable links in the system to providing ongoing services and connection with people who are close to the street. And it only takes one staff person on a team to become infected, and that whole team has to go into isolation. So a protection of staff and being able to access some of the protective equipment, and then some of creative measures like doing a rotation system where one team stays together for 2 weeks and then another team comes on after that. There's all sorts of really creative strategies that we're trying to employ, but it is a very vulnerable part of our services.
Last question for you, Susan, for now. What is, you have funders and donors on this webinar. What do you need most right now?
Well, we need a lot of really simple things like food, portable food, granola bars, those kinds of things, food that can be easily converted into takeaway meals. We need takeaway containers. We need, if any companies or businesses are currently closed and they have supplies of gloves or masks, these things are really desperately needed across the whole city in so many different places. but I put in an extra plea for drop-ins and other community services that are really doing some critical frontline work. So, and we need tents and tarps because we know people are going to be staying outside, fearful of being in shelters and other places where there might not be the social space that's required to keep people safe. So a lot of really basic things, and we really, I'll echo what others have said. We need the financial donations, and we also need the voice of folks to listen to what our advocates saying is needed. We have, a lot of empty spaces in the city, whether they be hotel rooms or university residences, and they could be converted into safe spaces for people who have no home to go to, where they can actually have all the services that are needed and have that safe space to ride this out. And that's the kind of advocacy that it would be fantastic if people could lend their voice to, and just ask questions and keep your ears open to see is there a chance to make a call or support some of the requests for strategies that we think will make a big difference during this time.
Thank you so much, Susan. I really appreciate it. We're going to come back to you with questions after, but I really, thanks for giving us an insight into the challenges you're facing, and I'm hoping out of today's call you'll get some support.
Thank you.
I'm going to move to Lindsay Kretschmer, the Executive Director of the Toronto Aboriginal Support Services Council, also known as TASSC. We've worked with Lindsay this year, and she is just a great advocate for Indigenous issues and Indigenous leadership. And we're so happy that you could join us this morning, Lindsay. Again, like everyone else, can you start with giving everyone a sort of a sense of what TASSC has been, and then what the reality is for TASSC today?
Sure. So good morning, everyone. Sego, I'm happy to be here with Toronto Foundation and my colleagues to participate in this really important discussion. The Toronto Aboriginal Support Services Council has been working since 1995 to bring together Native organizations in the city of Toronto to work on key issues relating to policy, advocacy, and more recently training. So we are not a direct service delivery organization, but the 18 members that make up our coalition are direct service providers ranging from housing to child welfare, to justice, to education, to employment. There's a full suite of services across the spectrum here in the city of Toronto for the urban Indigenous non-for-profits. Of the sector for Indigenous that is serving Indigenous, I would say that there's probably a little over 20 primary social service providers. Certainly that doesn't denote the grassroots arts collectives and other organizations across the city that do support Indigenous people, but there are some folks who have been doing a lot of heavy lifting in recent days on the front lines. Shout out to Council Fire and Native Child and the Toronto Inuit Association and Two-Spirited People of the First Nations and Native Women's Resource Center, Anishinaabe Homes, and to the countless other members of TASSC and beyond and friends of TASSC that have continued to do some of the heavy lifting in the last 2 weeks. We've been sort of capitulated into this very different world, but at the same time, not altogether too unfamiliar. TASSC member agencies serving the needs of the urban Indigenous community here in Toronto have been doing this in a chronically underfunded state for many, many years, in some case more than 4 decades. And so it's interesting because we look at this as though, we're sort of entering into crisis mode, operating with less than what we are used to. But the spirit of the resiliency that exists within these organizations, their leadership, their staff, their volunteers and communities certainly prevails. And I want to say that it's stronger than what this virus is. Indigenous leaders have not stopped working since this thing started. And I feel like that's what we do anyway. We pull together for community through that spirit of resiliency and love. The love that we have for our people and for each other to keep pressing through this. And so it's been an interesting time. I've been telling some friends of mine that I've probably worked harder in the last 2 weeks than I have in recent years of my career. I have spent the last 20 years working in this sector, and it's been a sudden shift, but we're managing. I think we're just doing what needs to be done. We have struck some really great responses with respect to this. We mobilized very quickly with a really small resource pool in terms of staffing, in terms of funding. We've been doing whatever needs to get done to ensure that the needs of the urban Indigenous community are being met. And there is an estimated 80,000 Indigenous people living in Toronto. And while we do represent a smaller segment of the population, we, of course, overrepresent across a litany of plight statistics, excuse me. So I think we've definitely, we've responded as we need to. Right now, our most vulnerable are our seniors, our elders, our single low-income families, single-parent low-income families, certainly our homeless individuals and those that are precariously housed. These are the folks that we are working hard every day to try to reach to ensure that their needs continue to be met during this time.
So, Lindsay, what could we do for you? What do you need?
I think I'd echo what my colleagues have said. There's no shortage of need for food, for donations to purchase food. There's definitely a need to make sure that we have the capacity to continue driving supplies around the city. Council Fire, for example, has been serving hundreds of people daily by providing 3 meals per day. We are all following public health guidelines with respect to ensuring that we are keeping ourselves and others safe while out there doing the frontline work that continues to get done. Council Fire has been also going forward and doing deliveries to the seniors buildings. There are some Indigenous housing providers like Wigwamen who have, I think, well over 2,500 residents across the city. Some of them are living in clustered neighborhoods. And so we're trying to make sure we're reaching people where they're at. And Council Fire has been really tremendous in trying to extend their reach beyond the downtown core. Native Child and Family Services has done the same. They've been actively working out in the West End, the East End of Toronto, and other parts of the city that are not as easy to get to. Indigenous population is quite spread out over the city. So as you can appreciate, with a small group of staff and volunteers, it has been no easy challenge to try to get resources to the folks that need them. I can give you an example of last week. I was with my 4-year-old son driving around to all the dollar stores in the city, loading up on supplies like kites and sidewalk chalk. And these things might not seem like a big deal, but they are for families who need to keep their children busy during these times. And not all families can afford or are willing or able to leave their homes to go and get these items. And so we've all been pulling together and lifting where we can. Sometimes we're toggling between, meetings, government advocacy, and then we're jumping right into the fire to make sandwiches to hand out to people that need them. So
I can see in the chat there are questions about the many members that you have, and I want to reassure everyone that we will be sharing links to all the members of TASSC and to TASSC directly.
Yeah.
If you have an interest in supporting these orgs, we highly encourage it. I wanted to reflect to you, Lindsay, that it just happened that the last gathering Toronto Foundation was able to have with some of our org partners and a group of women fund holders that we have put together was at Anishinaabe Health just a few weeks ago, just before things got really clearly serious, for a moon ceremony. And I guess, and maybe it's an unfair question, Lindsay, but I guess there are parts of your culture that I assume you tap into at these times. And I just love your reflection on that for the sake of all of us who could use some connection to the universe in a different way.
Yeah, that's a really good question. I think for sure, folks are continuing to try to tap into aspects of culture across the board. I've been seeing a lot of social media posts of jingle dress dancers, movements around drumming and singing and maintaining the culture through a virtual means, which is for some of us completely new territory. Most of our ceremonies and culture and practices often take place in socials or in events where we're able to gather in person. And so people have been really innovative in trying to bring aspects of the culture to the internet for folks who can access that information and participate. There's also been some tremendous work being done by agencies and individuals as far as getting traditional medicines to families, making sure that those are available, because our traditional medicines, we've known for thousands of years that these are things that can help us in times like these. Cedar tea, for example, is a very effective medicine that is used to help with ailments. There's Labrador tea. Council Fire has been providing medicinal teas daily to folks who ask for it. And so sort of going back to that place of using our traditional approaches to tackle this thing and to be well. Our healthcare system is predominantly wired to support the physical and in some cases the mental health needs of individuals. It rarely taps into the spiritual side, and that's where these organizations become so critical for the community, because that spiritual side of tapping into culture, to ceremony, to traditions, to language, to identity, it is these organizations that are doing that work. And that is sort of what I think is distinctive of other non-for-profit organizations within the broader setting, is that most of what these organizations are providing are cultural supports and access to culture and community in a way that is very unique to Indigenous spirituality and identity.
Well, I thank you for sharing that. And I think that was so important for everyone to hear, because that's certainly our experience in working with you and your many agencies. It enriches our lives, and because of that deep connection to spirituality. And I think we could all use more of that right now. So thank you. So I'm going to ask folks to take, I think we're bringing all our speakers up on screen, and I'm going to move to a Q&A here. But while we're setting that up, there's another poll set up in the taskbar. If anyone wants to go take a poll, we want to make sure we're tracking the issues that matter to everyone. And what I'm going to ask is everyone, all my speakers, to just mute your screens until I ask you a question. It'll just keep the sound a little bit cleaner and I will ask you each directly. I'm very proud of myself, can I just say, my team. I'm staying on time today, but they have texted me some questions. So I'm going to start with you, Neil. A couple of questions that have come up. This is actually a really important one. Should individuals prioritize giving money or food to the daily food bank?
It's a great question. It depends on your objective. So if your objective is the most amount of food going to people who are experiencing poverty, then the answer is to give money. We have seen the generosity of many Torontonians over the past few weeks. And that money is not going into expanding infrastructure. It's simply going into our food fund, and we're buying more food. But, you know, I think about it also from sort of a family context. You know, if you have the opportunity to be sitting with your kids now and say, listen, what do we have for dinner? Let's make sure somebody else has that same meal that you enjoyed. And maybe you purchase that food together. But there's an important life lesson that I think can be passed down, which would open up a conversation about why is it that that individuals are experiencing poverty? Why is it? What are the systemic causes of that? And to be able to have that conversation, that might flow from the very tangible reality of donating food. So both are very much appreciated. Both might have different objectives for the individual who is making a gift. Both are very needed and appreciated.
Thanks, Neil. Leticia, the question from the chat room is Black Creek Community Farm still accepting orders for community food boxes? And where can we direct donations for those in need in York Region? Don't forget to unmute, Leticia.
Of course. Sorry. So we have put a pause on the emergency food boxes right now. That's because this week we're delivering about 1,200 boxes alone. And because of the small capacity of our team, we wanted to make sure that we can get the food to folks right now, and also to make sure that we have the resources, basically the funds to make things run before it gets all crazy. So what we're hoping to do at the end of the week is open a new registration form for folks so that we'll be able to register. And we're really intentionally trying to prioritize the seniors in our community who do not have access to computer and things, and working with the partner organizations to make sure that we can register them first for the program so that they can get access to food. So we're being very, very intentional right now. And then, of course, we are definitely accepting donations. Unfortunately, our capacity does not allow us to deliver to York Region. And I will be happy to speak to any organization within York Region that would love to set something like that up. And then we can help and then have a conversation with Foodshare Toronto as well to see how we can get food to people in York Region if it's even within their capacity to do so. So yes, definitely, this is all the money that we're getting is going into the emergency food boxes, and we're doing it on based on how much funds we have. So if we have more money, it means we can register more people and get more food out to folks. Thank you.
Thank you. And I would also add that if anybody who's on the call has other suggestions for York Region, please do put it up in the chat because folks are paying attention. And though we have 4 amazing experts on screen, I know we have a lot of org leaders and experts and connected folks listening who we invite to contribute. Susan, where can people drop off donations? Or there was a suggestion from Neil, which we thought got a lot of like jazz hands in terms of Amazon as a delivery method. Is that possible? Or I'm going to make the assumption, Susan, on your behalf, that a financial donation is always the easiest, most flexible way to receive. But knowing that not everyone's capable of that, are you receiving food donations? And if so, where?
So right now, the tiny but mighty team of TDIN is trying to coordinate those kind of material donations and working with our members to centralize a drop-off and pick-up point, which at the moment is Holy Trinity Church. So yes, cash donations either directly to the local drop-ins, and it's a good way to recognize a small organization that's doing amazing work in your neighborhood, or to TDIN, and we'll disperse those funds to our members, and that enables the members drop-ins to be able to use that money for what makes sense. It might make more sense to do food cards so that people can go and purchase their own food, the folks who are able to do that, or coffee cards. Because I just want to highlight something that I think all of us are probably experiencing is a loss of our community places. But for folks who are homeless, with the closure of libraries, with the closure of community centers, with the closure of community services, the stark reality is there's nowhere to go. There's not even a place where you can use a washroom and wash your hands. So not only are the places that are open and drop-ins really important for that, but we have to be, I know the city is going to be setting up some portable hand washing and toilet stations. So we're talking about pretty practical things that also are so incredibly important for people's dignity, to be able to access these things without having to run around town and find them. So I just wanted to share that. It's not something that we would necessarily understand unless you've had to spend some time on the street.
Thank you, Susan. Lindsay, we have a question about whether there's a national organization similar to TASSC where folks that aren't in Toronto could send donations and support Indigenous causes. Don't forget to unmute, Lindsay.
That's a really great question. The urban landscape in Canada for Indigenous people is quite broad. There is an estimated 6,000 plus registered Indigenous-led non-for-profit organizations. We are part of a national coalition made up of TASSC-like organizations across the country in some major and smaller cities and provinces and territories. So of those 32 other coalitions, you can get in touch with MVEC, which is my Vancouver equivalent. That's MVEC is the acronym. You can Google them. You can get in touch with them to find out about the other coalitions and the work they're doing in other cities. You can also look to the National Association of Friendship Centers, also known as the NAFC. There's also the MNC for the Métis and ITK for the Inuit. So there are some national urban players that do organize provincially, territorially, and certainly locally. So that would be one way for sure. And of course, to First Nations via the AFN, that's the Assembly of First Nations, also getting in touch with them too for on-reserve supports.
It's a good point. I should just reinforce that a lot of First Nations communities are qualified donees and can receive donations. So that is also a route. A question, sort of a question for all, or you just hand raise if you have an answer. These are sort of questions coming up in chat that we wondered if you folks or anyone else listening has an answer for. First one is Children's Book Bank is looking for a partner in food security to help distribute free books to families. Any ideas?
We have distributed, we just entered into a partnership this past week on being able to distribute. It wasn't with the Children's Book Bank, it was with a different organization, but there's no reason why we can't replicate it. Our thinking was, as individuals are at home and might not have access, well, don't have access to the library, and they are picking up food from the different member agencies of the Daily Bread Food Bank, could we tag on boxes of books? And so that is rolling out sometime in the next week or two. So probably next week. So if they'd like to give the Daily Bread a call, I think, you know, what we're good at is distribution of large things, and so you know, we would be pleased to enter into that conversation.
Likewise for the urban Indigenous community and ensuring that we can get books into the hands of kids who do need them.
Wonderful, thank you. There's a lot of questions about whether or not some sort of volunteer or skills-based questions. Do any of you know of or need any specific skills that could be donated to you, or are any of you still recruiting drivers? Because there's some folks online who are willing to help that way.
I can say that we could definitely use drivers across the city, and if folks wanted to get in touch with me directly, I could help to pinpoint them to the member agencies that are doing deliveries across the city.
We're in need of DZ drivers. That's been a gap that we've needed to fill.
Mm-hmm. I can't. Sorry, I can't really speak for Foodshare Toronto, but in terms of drivers, I think if they can get in touch with Foodshare Toronto, maybe there is some support that's needed there. On the Black Creek Farms, and I think for us, in terms of what we need is really the dollars to support more emergency food. And also someone, if you are a graphic designer out there, or you're very good with website and can sort of help us with some content management, that will also be greatly appreciated. Or actually the other thing is a software for collection of people's information. So right now we're using Google Forms, and so let's say somebody got their address wrong. It's like, imagine calling like almost 2,000 people to confirm addresses and things. So if there is a software out there that we can get support on to make it much easier for the collection of the information, it will be greatly appreciated as well.
Great. Susan?
I was just going to add that we're in the process of trying to gather what some of the needs are of our members, and besides the physical things that I've described around food takeaway and hand sanitizers and that sort of thing. But I would just encourage anybody who wants to volunteer to get in touch with TDIN. I know if there's a possibility of doing food, making food distribution, whether it be some soup or chili or sandwiches, and being able to deliver them to a local drop-in, that would make a huge difference. Yeah, so both in terms of food and driving or anything else, we will try to hook you up to your local drop-in and see what kind of contribution you can make there.
So last question for you all, and I'll ask you to answer briefly because I'd love to hear something from each of you on this one. We've got about 2 minutes before we wrap up, and that is sustainability in these times, and whether any of you are feeling threatened organizationally, and how the government, how you're feeling about the government support. I know, Neil, you've already highlighted that the city's been fantastic, but just a quick reflection on the long term. We've been talking really a lot today about immediate needs, and I think that's absolutely critical. But as you look ahead, what are you seeing, and yeah, what are you seeing? Maybe I'll ask Lindsay to start.
Mm-hmm. So I would say, sorry, Sharon, actually, can you just rephrase for me? Can you repeat the question?
I guess I'm just saying, like, what is the long, for TASSC and all your agencies, what's your big fear, and how are you feeling supported outside of donations?
Sure. So I would say that right now, most of us are dipping into financial circumstances that are not designated for COVID responses. And so many of us are depleting resources at a very rapid rate, and we will not have a sense of what that looks like until we come out on the other side of this and actually do a full analysis independently within our own organizations to understand how this has affected us. I can tell you, there's been huge expenditures. I know that Council Fire has had to go forward purchasing hotel rooms out of pocket. There has definitely been financial impact. We will need relief and recovery funds. We just put out a communique, which you would have received, asking for those interim relief and recovery funds right now. The amount that we've asked for the grand total for all member agencies is $500,000. That is for right now. That is looking at just the last 2 weeks of what we've been collectively spending to respond to the needs of community across the city. And so certainly we'll have to look a couple of weeks out to see where we're at that point in time too. Fortunately, some funders have been gracious enough to allow for more flexibility to move between line items and spending, but that still doesn't cover off what we've been having to utilize in order to meet the needs of folks. And there have been wage increases. There has been a tremendous amount spent on food cards. We're also trying to set up, just a last point on food, innovations around how do we get food to people given the limited resources for volunteer drivers and the tremendous amount of pressure that's putting on people to try to get out to everyone in the city. So we're trying to set up grocery online services where people can call into a central intake to register for what their grocery needs are. For example, we've got a lot of moms with more than one child, so they can't stand in the grocery store lineup with low income for however long it takes to get groceries with 4 kids in tow. I can't even do it with 1 kid in tow, my 4-year-old. So I can appreciate that we have to get creative about how we're going to respond to the needs. And we did an estimate cost breakdown on what it would cost to feed 150 people for 1 week using that service, and it's about $15,000.
So I'm conscious of time, but I feel like what Lindsay covered, I saw a lot of nodding heads. I feel like we're all just still a little stunned at the today reality, and gotta find a time to come up for air to, to figure out what 3 months from now looks like and what 6 months from now looks like. And so, though I'm not going to give you each a chance to answer that question, I would love you to answer it after for us so that we can post it, if that's okay with everyone. Because it's 8:59 and you've just shared so much wonderful and important information with us. I want to thank each of you for coming this morning. Thank you so much for your time, and more importantly, for the work you're doing on the ground right now, putting in a lot of hours to serve your communities. So thank you for that. all four of you.
Thank you to the foundation for doing this and helping the helpers. Really, really appreciate it.
Thank you.
Yeah, and take care of each other. Be well.
Nella, thank you.
Just a couple of wrap-up comments as we look ahead to next week. I do need to say thank you, a big thank you to Vancity Investment Bank, who has provided this platform, who seed funded the Better Toronto Fund, which is now upwards of $100,000 and growing rapidly, and you know, really has been created a domino effect for us in terms of our ability to gather a lot of important conversation here each week. And so to Jan Gilroy, who was with us last week and will be back again next week, I just want to say another thank you for leading the charge at Vancity, and her team has just been incredible. We will be sending you a follow-up email with a survey. We really want your feedback on today. We've identified the issues that we'll be tracking, but let us know if there's something that we've missed. We strongly encourage you to consider donating directly to the organizations you've met today and any other small, medium orgs, especially the grassroots orgs that are, we have a growing list on our website. Directly, unrestricted, flexible funding is ideal. Check out torontofoundation.ca for this list, and it will grow over time. Next week, we have Debbie Douglas from the Ontario Council of Agencies Serving Immigrants, Shelley Nichols, the head of, I'm so sorry, the head of Sistering, which is for socially isolated women and trans people, and the head of the Massey Center, which is an infant and childhood mental health organization, and we'll be covering those topics next week, and I hope you will join us and invite others to join us. I ask you all to stay safe and be well and be generous and be courageous. Talk to you next Thursday. Goodbye, everyone.
Bye. Thank you.